Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir, and we discuss the lower end of the humerus. Note, the lower end of the humerus flattened anterior-posteriorly. It consists of two epicondyles, which are non-articular, they do not articulate, and it is medial epicondyle, which leads to the medial supracondylar ridge, and the lateral epicondyle, which is less prominent, and that is which follows the lateral supracondylar ridge. And you already know that attached to the medial supracondylar ridge is the prototeres muscle, while on the surface of the medial epicondyle you can see this very prominent facet, and this facet on the anterior surface of the medial epicondyle, it is for the attachment of this superficial group of flexor muscle. You can see this is medial epicondyle, and this prototeres, flexor carpi dalis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris, or you can see the common flexor tendon, in short, is attached to this facet on the anterior surface of the medial epicondyle. And this medial epicondyle, you can see it is very prominent and it is very easily felt over here on the medial side. And note one point, that in the posterior surface of the medial epicondyle there is a groove, and lying in this groove on the posterior side over here is the ulnar nerve. In this way you look, ulnar nerve is related posteriorly to the medial epicondyle. Axillary nerve is related posteriorly to the surgical neck of the humerus, while the radial nerve is being related to the mid shaft of the humerus on the posterior side in the radial groove. And then the lateral epicondyle, which is less prominent and less easily palpable and present over here, you again know that attached to the lateral supracondylar ridge, also called the lateral supraepicondylar ridge, is attached this brachioradialis, extensor carpi dalis longus, and then the extensor carpi dalis brevis, and then the facet on this anterior surface of lateral epicondyle, it gives attachment to the common extensor origin. Through this common extensor tendon, many muscles of the extensor compartment, the posterior compartment of the forearm, are being attached over here to this facet. Then the other two parts of the lower end, which you can see over here, these are the parts which are, making joint with the radius and ulna, and they are articular, while the two are non-articular. And these ones, the lateral one, you can see the lateral one is called as capitulum, and you can see this capitulum extends anteriorly as well as inferiorly, but on the posterior surface the capitulum do not extend, and this articulate with the head of the radius bone. Look, it articulates with the head of the radius, and just superior to the capitulum you can see this small fossa. This is radial fossa, and it accommodates then the head of the radius in flexion of the elbow joint, this radial fossa. And then medially a big flange, this which is called as trochlea, and it is also articular, and you can see it extends anteriorly, medially as well as posteriorly. And this trochlea, it articulates with this pulley or trochlea of the ulna over here, and in this way the trochlea articulates with the trochlea, it articulates with the trochlear fossa, tracheal notch of the ulna, while the capitulum articulate with the head of the radius. And then just superior to the trochlea you see over here and the fossa, which is called as coronoid fossa. And this coronoid fossa, it accommodate this coronoid process of the ulna in full flexion like this. While on the posterior surface, you can see a very big fossa of the humerus. This is olecranon fossa, and this olecranon fossa, it accommodates this olecranon process of the ulnar bone. This way, this is olecranon fossa, this is coronoid, and this is radial fossa. Okay, this is about the lower end of the humerus, and at this point you note that three nerves are related to the radius bone. Over here, the ulnar nerve in contact with the medial epicondyle, no soft tissue between the two. And over here is the radial nerve, and over here is the axillary nerve. In this way, if there is fracture over here, and over here, the three nerves are in danger to be injured during fracture of this area. And you know, the axillary nerve is the main abductor that supplies the deltoid, and the radial nerve it supplies the posterior compartment of the forearm, and the ulnar nerve it is the again it supplies some of the flexor muscle of the forearm and then the muscle of the hand. So these 3 points, note the point, if there is fracture, you must think that the nerve may not be injured. Immediately you should be worried about it. Thank you very much.